Hi, my name is Jen Berkman, and I'm the marketing manager for medical specialists of the Palm Beaches. We are here today with board-certified family medicine physician, Dr. Ann Thomas. How are you today?
I'm doing well, Jen. Thank you.
That's great. That's great. We're so glad to have you as an addition to our team.
I'm very excited. I'm very excited, very thankful for the opportunity. It's going to be great.
It's going to be awesome.
Yes.
So my first question for you is, if you could be anyone for a day, who would it be and why?
So it's an interesting and tricky question, but could be fun. So thinking about that, I went through different scenarios, and the one that I came up with that I was a genuine answer would probably be one of my kids. And so I have two boys. And one is soon to be 9 and the other one is just turned 7. And I really, wonder how they perceive the world, how they receive the world. It's so different than when we're adults, when we have all these biases and experiences. And, there's some benefit, pros and cons to both. But I really somewhat, envy the fact that they can live life with so much awe and wonder and curiosity, and they're so resilient. My first son was born with a heart condition, and he is the strongest, bravest kid I know, or human, really. And his resiliency, I've learned so much from. And so it would just be a cool day to experience the world through their eyes at that age.
Children have such boundless energy and they're so hopeful.
Yeah.
I can imagine.
Yeah.
That's a good reason.
Yeah. And they have a lot of fun. Bad things happen. They shake it off.
I know. They're like impenetrable. They're like bulletproof.
Yes.
Yeah, I agree. So my next question is, why did you decide to become a physician?
So I would say it was over the course of my life, but I grew up in a household with a lot of people in healthcare. My mom primarily was a nurse, and I saw how hard she worked, and she really cared about her patients. But I saw how hard she worked, and I was like, I can't be a nurse. They work too hard. And
it's a lot.
It's a lot. It's a lot. But she was dedicated. And then, I just had a love for science and learning. But it was really when I found my passion for family medicine, specifically in medicine, was I did a medical mission trip to Honduras with Global Health Organization. And what I saw there, what I experienced there, the people, the heart of the people, I just fell in love with it. And I knew that's what I was going to do.
That is incredible.
So in family medicine, as you know, we treat patients from birth to end of life.
Yes.
We do women's health, small procedures. It's such a great general practice that when you go out into the world, it's really applicable, in so many ways. You can help so many people. And so that's how I found family medicine. That's why I love it.
Wow. Yeah. That life-changing experiences, it always turns us to where we need to be. It's like your calling.
It is my calling. That's
so that is incredible. That is just, it's a beautiful thing when you find where you're supposed to be and what you need to do, and you have a purpose. Incredible.
Yes. I agree. The days can be long and hard, but when you're passionate about it, that's what gets you through.
Yes.
You love it.
And people can see that. Definitely.
I hope so.
Yes. Yeah. No, they can see it. They can see it. So my next question is, with primary care, what is one thing you wish people knew about it?
Honestly, right now, in the time that we're living in, I would want my patients to know that the doctor is on your side. We are in your corner. We care about you. We care about your families. We care about what you're going through your life. And I think a lot gets, I love the knowledge of, the information era that we live in right now. It's wonderful. And I believe in patient education, but I also think there's something lost from the side of the doctors to the patients, where sometimes it's misinterpreted in the media or on the news. And that message gets lost, that the majority of physicians really care about their patients. I mean, that's why you go into this field. If you wanted to make the money or the lifestyle, you could choose dozens of different professions. But truthfully, if you are in medicine, we are on your side. We care about you. I always tell my patients, I'm always going to be honest with you. And if you have any question, I'd rather you just ask me and I will tell you the truth. I will be honest with you. And if I don't know your answer, I will find out and we will get you to your health goals, your family goals. We'll get there together. So I think that's a big thing that I would want everyone to know, that, you should have a physician you trust. That's important.
I believe trust is the foundation for a patient and their doctor.
Yes.
So yes, I 100% agree with you. And I think a lot of people also agree with you that they have to trust their doctor, be comfortable, be able to ask questions,
Yes.
not just run to the, internet to find an answer, but to actually ask you.
Yeah. Yeah. Because it has to be specific to your situation, your health, your history, your family history. There's risks and benefits. And I think if you foster, and it goes both ways, it's like the doctor trusts that you will come to them with your concerns, and the patient trusts that the doctor will be honest with them and share the truth. And, and it really depends on the person, but it's a relationship that you form of mutual respect and trust. And I think that's how you get the best, it's a journey of health. And so that's how you get the best outcomes to meet your own health goals, I think. And so when I find a patient or a friend in a social circle who says they don't feel comfortable with their doctor, I say, well, that's really important. So it's okay if you don't click with the first person you meet. You will find the right fit, but don't feel like you have to be stuck in a situation where you can't ask your questions.
Wow, well said, well said. So what's one thing that people can do every day to maintain good health?
So I would say two things.
Okay.
So one, and I think they have equal value. The first thing I thought of was, mental health is a big thing that has, it's become an issue or concern, a challenge over the past 3 years, especially, following everything that happened with COVID, high rates of depression, anxiety, suicidality, even among our teens across all ages, actually. And I feel like that has fallen to the wayside sometimes because of all the other things that have taken priority or urgency. And mental health, it would be the one thing I would say, don't push that to the side. If someone's struggling, seek out the help. There's a lot of help. The doctors, we tried to help with access to therapists and care, and it's not always medication. But mental health would be the thing that I would say is focus on a daily basis. So that ties into my second part of my answer is one thing is have your systems in place. It's just something I believe is it helps carry you through. So there's a quote by James Clear that says, we don't rise to our highest goals. We fall to the lowest of our systems. Meaning if we have something in place, like you wake up at a certain time in the day and start your day off in peace, quiet, start your day with quiet time or preparing or meditation or exercise, it sets the tone for the rest of the day. And if you have that in place, like it doesn't have to be perfect, but if you have a system, Monday, Wednesday, Friday, this is what I do, or every morning for 15 minutes, I do this every morning, it starts your day off right. It's a system that carries you through in place. And that speaks to your mental health as well, is you're making time for yourself. You show up for yourself. And I think that's important. It ties into preventative care. And that's a big thing in primary care. In family medicine is we believe in prevention. Decades ago, people used to just respond when something happened. You weren't feeling well, then I'd go to the doctor. I still have patients who say, oh, nothing's broken, so there's nothing to fix, right? But we've kind of moved away from that, and we're focusing on prevention. So I think the short answer would be set some systems in place on a daily basis, eating healthy like making healthy choices for your diet, exercise, and making time for mental health.
Those are incredible. Those aspects of our life, sometimes we ignore them, like you said. So those are important to really pay attention to, especially like you said, the mental health part. Yeah. It's important. So with our last question, give me a story about one of your favorite patients.
Oh, a favorite patient. Yeah. Luckily, I have great patients, and I'm sure that will continue here at MSPB. I would say, part of primary care is, you really get to know your patients. You see them through the good, through the bad. And two patients stand out to me. One was a patient who saw me. She was super anxious, very worried about meeting the new doctor because she had just joined our office. And she showed up like 30 minutes early to her appointment. She had all her papers. She had all her, her questions written down. And, she was so anxious about making sure everything, like all her questions or her concerns were answered. And I remember meeting her and, I took the time. We took the time, we answered questions, we got to know each other. But the valuable thing is for primary care is we see them often as concerns come up, health issues come up. And so over time, over the years, we got to know each other. And, unfortunately, one day she wasn't feeling well and, we did the workup and we found out she was diagnosed with renal cell carcinoma. And that was a hard thing, but I got to walk through that journey with her. And one of her choices was that she didn't want intervention. And, so we talked about the pros, the cons, the risks, the benefits. I had her see our specialists to find out what that would look like if she did, treat. And she chose not to. And the relationship that you have with your patient is that you make sure they understand it's informed consent. And I respected her wishes. And so what we did was we walked through with her. And thankfully, she's still alive. She's doing great. We have her with palliative care. She's enjoying her wishes were, she wants to enjoy her life. She's independent. She has her family. She has her grandkids. And she wanted to enjoy that. She didn't want to spend time going to the hospital and doing tests and surgeries and chemo treatments. And we came to form a relationship of mutual trust and respect. And she became one of my favorite patients. And, I was always happy when I knew I was going to see her that day. And she's such a wonderful human. And I think that's how we felt about each other. And it's one of the beautiful things about primary care is that you can walk through life for years knowing your patients and what they go through, the ups and the downs. So I know about her grandkids and her family and her vacations.
Sounds like her inspiration to keep pushing forward. That's for sure.
Yeah. Family is a strong motivating factor. And, just she knew what she wanted. And that was important in honoring her wishes. And the second patient is a shorter story, but someone also that I got to know over time. And, she kind of gave herself the title of my kid's Jewish grandmother. And so
I love it.
So she is one of the other patients that I love knowing. I was going to see her that day. And if she didn't come to an appointment, I was like, something's wrong. That's not her. We need to call her and check on her. And, she's doing great. She was in my previous practice. But she would always ask about my grandkids. She would tell me about her trips to Israel. It was just great. It's just a wonderful relationship. And, and patients sometimes are surprised that we think of them and that we worry about them or that we remember them. Like, of course I remember.
Of course, I remember every detail of your life, actually.
and sometimes they're surprised. And I'm like, well, that's why I have this chart. I have an EMR and, I write down notes. So I remember these things. But then after years of knowing someone, it's just you have that relationship with them, that rapport.
Oh, yeah, wonderful. This was a beautiful interview with you, Dr. Thomas. I appreciate you coming and being here with us and talking about, all your different experiences. Thank you so much.
Thank you. I appreciate it.
So what I would like everyone to do who's watched this is to follow us and like us on YouTube, Instagram, and our Facebook page, MSPBHealth.com. See you soon.